You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, don't let your fear of the dentist keep you from having the smile you've always wanted. With us, we have Santa Barbara's dentist, Dr. Johnson. Dr. Johnson, welcome to the program.
Great to be here. Thank you.
For people that don't know you, and we've had you on the program before, who's a typical patient? What are the different procedures you do? And I guess you have 4 offices. Where are they?
Yeah, we do have 4 offices. We have 2 actually in Santa Barbara, and then we have one just 30 miles south in Ventura, and a few miles north, about 20 miles north up in Solvang area, which is a beautiful Danish community.
Now, your dad was a dentist.
He was a dentist, yeah. He practiced for 43, 44 years. In fact, this year, 2013, we are celebrating our 50th year of being in family practice.
Now, let's go over the list of some of the things you do.
Sure.
Okay, because we're talking about sedation dentistry today. Don't let your fear of the dentist keep you from going in and getting work done, right? And by the way, is that a big problem?
It is.
Are there a lot of people out there?
It is a big problem. Right now, I would say there's a statistic out there that says about 70% of all people have some type of fear of the dentist, whether if it's the smell of the dentist, or not the smell of the dentist, but the smell of the actual office, or it could be the noise factor, or perhaps the shot. People just don't like that. But 30% of the people have a dental phobic. They absolutely cannot stand the dentist.
Is that right?
They are extremely fearful. In fact, to the point where they will resist going to the dentist at all cost. And that can be a problem.
So backing up, though, to the different procedures, I mean, you do everything.
We do everything.
Pretty much.
Absolutely. Anywhere from fillings, of course, to cleanings. And we do a lot of cosmetic dentistry as well, because someone will come in, they'll want maybe their front tooth fixed, or they chip their tooth by eating on a sandwich. And we can fix that tooth on that same day, which is really kind of cool. Other things that we do is we do a lot.
When you say same day, so you have like a crown machine that makes crowns right there?
We actually have technology where we can make a crown. If they need a crown, someone comes in and they break their tooth, we can have them come in that same day. They can call up in the morning. We'll see them later that morning or in the afternoon, and we will prepare their tooth and have a crown made for them. It's great stuff, and the patients love that because they like getting it done in one appointment if they can. But all the things we do is we do a lot of dental implants. We do a lot of dentures. A lot of people in Santa Barbara and San Ynez, they wear dentures. They don't necessarily like the way they fit, so we'll place a couple of implants under the dentures, and we'll
like a snap in, snap out.
It's incredible because then they can bite into an apple, something that they really truly enjoy now. And then the other things that we do is sedation dentistry. It's been a big part of our practice lately. It's amazing how many patients have somewhat of a fear of coming to the dentist, whether if it's for a filling or a cleaning, even a cleaning. Somebody might want to be sedated for that. But of course, for longer procedures, we have the capability of doing what we call IV sedation, and we could talk about that later, but it's a fabulous service that we provide.
Now, sleep apnea is another thing you list on your website.
That is absolutely correct. We do sleep apnea. One of our doctors, Dr. Jeff Plicka, amazing individual, but this is what he specializes in, has gone to extra training to do sleep apnea. There's a big segment of the population who they snore. Not only do they snore, they actually stop breathing during the middle of the night, so it can be kind of scary. So there are sleep clinics in Santa Barbara as well as down south in Ventura area that patients go to. They have these studies done, and then they'll refer a patient perhaps to our office or to other offices that are doing sleep apnea, and we can make a very comfortable appliance to allow their airway, to allow them to breathe better.
Now, is this true that there are people that have been on the CPAP machines?
Yes, yeah, absolutely.
That work, obviously, but they're tough, I guess, to use, but that with what you're doing, that they're off the CPAP.
Right. No.
With an appliance.
When they see what the types of appliances we can make, they want to go off the CPAP. Because think about it. Think if you're hooked to a CPAP, you're breathing. To me, if you're married or you have a spouse,
you're also using lasers in your practice. For what? How do you use lasers?
We are doing lasers, and there's a great benefit to lasers. So somebody who has bleeding gums, or and bleeding gums can cause bad breath and things of that nature. So the laser can actually trim the tissue back. And it's very simple. It's an easy process. It's an easy thing that we do. The other cool thing with the laser, let's say we're doing a smile makeover and their gum tissue is slightly uneven and they have excess gum tissue. We can take that laser and I can recontour the gum tissue right there. It's phenomenal. The patients.
So no more gummy smiles.
No more gummy smiles. And a lot of times, let's say you do an Invisalign case, some orthodontics, and you finish the case up and maybe they have a little bit of gingival inflammation, some puffy gum tissue, or one tooth might appear to be longer than the other. When you're done, their teeth look beautiful and straight. Well, you could take that laser, you could trim that tissue back and make a nice, beautiful smile. Patients love it.
Okay, root canals. You do root canals too?
We do root canals.
You do, or you have a guy that does root canals?
You know what? We do have a guy that does root canals, but I do a lot of root canals myself. I love doing root canals. Actually, I call them a friendly root canal, believe it or not. I mean,
is that right? Why?
Well, because it's virtually painless. I mean, patients just do not feel what they're having. And the reason, it's not just because of me as the dentist, it's just that with the newer techniques we have in dental anesthesia, we can give them profound anesthesia. We can make them totally numb, and patients love it.
Okay, let's talk about sedation dentistry. Okay, so if you're just tuning in, we're talking to, I called you Santa Barbara's dentist. I mean, the practices, the 4 practices you run are some of the busiest practices in all of Santa Barbara. No doubt about that, is that correct?
No, that's true. We are very busy.
Okay, but you said don't let your fear of the dentist keep you from having the smile you've always wanted.
Absolutely.
So let's talk about the different levels of sedation that you have in your practice.
You know, great question. In fact, all of our dentists are trained in some form of sedation because the lowest level of sedation is nitrous oxide. Any dentist can do nitrous oxide, or what people call laughing gas, right? And patients in our office, they're used to it. They come in, they actually ask for it. And so, in fact, what they say, it's kind of funny, is they say, can I have a cocktail? And sometimes they'll say, can I have 2 cocktails? You know, and we know what that means. We know what type of how deep we could take them with the nitrous oxide. And
that's just putting a little mask on.
It's great. In fact, you know, it's perfect for someone who has a gag reflex.
You don't charge extra for that.
We don't. Actually,
is that right?
We don't. You know, it's a free service to the patient because let me tell you, if they're a relaxed patient, we're going to be much more relaxed as a dentist working on them, and we want them to be very comfortable.
Interesting.
So no, we don't charge for it.
Now, you know, I told you my own personal story. Had it done 1 time, no, twice. It's like a day at the spa. I mean, I'm not exaggerating. I'm not trying to side with you here, but nitrous is really nice.
Oh, it's incredible.
Why don't all dentists offer this?
You know, to be honest with you, I really don't get it because it's very simple.
But you tell your buddies that are dentists that don't
all
do
the
it?
time. In fact, those that we work with, we say, you know, offer for free. It's very inexpensive. But I think a lot of it is they start a procedure, and most dental offices do have nitrous in their offices. I mean, they just have it. They have it on a little cart. They wheel it in. But I think it's if they're in the middle of a procedure and they could tell the patient is a little rambunctious and not feeling relaxed, a little tighten up this, figure, well, I only got a few minutes left. I could finish this up and get out of the room. But it's like, just take a time out. Go get the nitrous. You don't have to do it. Have your staff wheel it in. You can go do an exam or go take a drink of something.
It takes like what, a couple of minutes?
That's
or so?
it. Yeah, and then just put it on them.
What about a deep cleaning? My dentist here
Right.
in Carlsbad, just for a deep cleaning, I had it done, and I'm going, whoa, this is
Oh,
great. It makes me want to go back.
Yeah, in fact, we suggest it.
Really? Okay.
Absolutely, because you know it does. I mean, a deep cleaning. You know, most of the time when you had a deep clean, if you had it done, you probably had some anesthetic, right? And
I think
again,
so, yeah.
some patients have a little fear of the needle, so the nitrous oxide just takes the edge off there. Like you know, I don't drink myself, but again, our patients just say, you know what? It's like having 1 or 2 cocktails. It's like getting a little buzz. They feel very good. And the great thing with nitrous oxide, boom, you take it off, they're done.
So it's safe.
Totally safe. And then they can walk out, they can drive, and it's not a problem.
So what's the next level up of sedation?
You know what? The next level is what we call oral conscious sedation. And we kind of call this our twilight sedation because people are kind of going in and out of sleepiness. And it's a little blue pill that we'll give them, and they love it because it just relaxes them. It causes them to go to sleep. And the great thing about triazolam, which is our little blue pill that we call it, it does have an amnesia effect to it. And so they will have little, if no, recollection of the appointment. And the other fun thing with the oral conscious sedation is for us as dentists and even the patient, we can have a conversation with them. We can say, you know what, we know when they're ready to have work done is if we ask, say, are you ready, do you feel like you can get up right now and go shopping? And they'll say, yeah, I think I can go shopping. Okay, go give me another pill, because they might need 1 more blue pill. And then we'll give them another one. We'll wait a few more minutes, and then we'll ask them again, and they say, they can't do anything. They're just very sleepy.
So they're just totally relaxed. Do they ever not even know that it happened?
Oh.
Like they say, are you done?
Yeah, most of the time when they wake up, they say, have you started? You know, and of course, those are 2 favorite words coming from, you know, for a dentist. We're like, yeah, we're done. We are absolutely done.
Now, the next level up from that is the IV sedation.
IV sedation, and this is an amazing thing. IV sedation is really where it's at right now because there are so many patients who are very fearful where nitrous oxide just won't work. Even we've had patients coming in, and the number 1 question they'll ask is, will I be totally knocked out? Will I be asleep? Because I don't want to have any consciousness of this. I don't want to be aware.
They're that phobic?
Oh, absolutely. It's incredible. And so we actually call this our dream state. You know, we do. We just say, hey, look, we can actually put you in a state where you're just dreaming away. And you're going to wake up, and the number 1 thing that they ask us when they wake up is, when are we going to start? And they've been out for 3 hours.
Is that right?
It's incredible, yeah. And then we say...
Now, very few dentists, by the way, do this. We should mention this. I guess less than 10%
right.
across the country.
I would say less than...
General dentist, less than how many?
I would say less than 3%.
Less than 3%?
I only know 1 other dentist in Santa Barbara County that does IV sedation, and I don't understand why more aren't doing it. And so it's an amazing service that we offer because there are patients out there that are so scared and so fearful that if they knew they can actually be put to sleep and be dreaming away and wake up and have all their dental work done, more of these fearful patients would be coming in. And they wouldn't be
Okay.
walking around with having these toothaches and these abscesses, because there's so many that are walking around with severe infections.
Is that right?
And it just breaks my heart. I mean, you go right outside here to your mall, and I guarantee
There's somebody out there in
30%
pain.
in pain right now.
Is that right?
And are afraid to come in.
Because I don't hear about it, obviously. They're not going to tell their friends or people
No,
they know.
they're embarrassed about it because they don't want to talk about it, because they feel like that's something that they can't overcome.
But what about safety, though, with IV sedation? How does it stack up against these other...
I would say it's safer. I would actually say it's
Is that
safer.
right?
And the reason is because we as dentists who do the IV sedation, it's much more predictable. It's much more
What
controllable.
do you mean by that? What do you mean?
Well, meaning that let's say somebody is under a light IV sedation. We can bring them deeper within seconds. We can take them out of the actual conscious state within seconds.
Okay.
Where oral conscious sedation, it's a pill. They're going to be groggy. They're going to be sleeping for 4, 5, 6 hours. We can't take them out immediately. So they have to sleep that off. Where IV sedation, you can take them out within minutes.
What about statistically? Is it safer?
Statistically, it is safer. It's
Like blood pressure's lower, things like that?
absolutely.
Are you
Yes.
monitoring
No, I'm glad you brought
those
that up.
things?
We are monitoring. They're hooked up to a pulse oximeter, and we have an EKG, and so we can monitor. We can actually keep their blood pressure very stable, very safe, and it's incredible.
I think going into this, and I was confused, because I think of it as anesthesia.
Right.
But it's totally different than having a tube in your mouth. I mean, this is just IV sedation.
This is just IV sedation. So you're right. There is the deepest form of sedation, which we do not do. We do have one dentist, however, Dr. Wendy, just came on our team. This guy is amazing. He's actually considered a dental anesthesiologist. So he can do these intense cases with general anesthesia. And it's great in our dental practice because there are young children, ages 1, 2, who need a lot of dental work.
Interesting, okay.
And so he has done a lot of these cases. In fact, he said the youngest case that he's done is 26 weeks, where he put a little baby to sleep and kept them asleep, and they did the work on him. And so he's had great success with this. And so as a parent, knowing that you have a specialist who can take care of those needs, it really relieves a lot of the fears and the anxiety.
So a dental anesthesiologist?
Yeah.
I didn't even know that existed.
I know, isn't that incredible?
Okay, good. Now, you have photos of
We
people
do, yeah,
that,
absolutely.
people are watching this. Don't let your fear of the dentist keep you from having the smile you've always wanted. But the other part of sedation that we haven't talked about, that we talked about on the telephone, is that IV sedation or sedation dentistry allows you to do a lot of different procedures that may take 5 trips to the dentist in one day. Like the type A personality.
Right.
The Hollywood guy that never has time for anything, supposedly, right?
Yeah, absolutely. In fact, I'm glad you brought that up, because there are many business persons, men or women, or busy mothers who cannot break awake and have multiple appointments. They might not be afraid of the dentist, but they just don't have time to get it all done. And so somebody who does need a lot of work done, a couple crowns or a few root canals, or if they want to have a complete smile makeover, yeah, we could put them to sleep, and we can do it all in one visit. Now, the great thing with that CEREC technology, or the E4D technology we were talking about,
Which is what, making a crown?
It's making a crown is in our office. It's a computer-assisted digital crown that we do in our office, and we actually have a lab tech that's in there the whole time. And so we have a patient. If they go under IV sedation, they need a couple crowns. We'll prep the crowns first. We'll take the impression. We'll give it to my lab. Say, make these crowns. We need them back in about an hour, hour and a half. He'll have the crowns made for us. So by the time we're done with the rest of the things that we're doing under the IV sedation, we can submit the crowns in. Wake up, it's all done.
Okay, so IV sedation, nitrous. Now, so there's a lot of people out there that are like that they're kind of miserable with their teeth, but it's just they don't have the time or their fear.
Yeah, you're right.
So you got to wipe that out, is what you're trying to do.
It is wiped out. We can wipe that out. I mean, they really, if they just put their faith and trust and give us a call, or any office that does IV sedation, they can handle their needs.
The part that I find hard to believe, though, is that, okay, you get IV sedation, you're there for maybe 4 or 5 hours, getting a bunch of work done, right?
Right.
And then when it's all done, you say that some of them say, is it done?
No, well, that's the first thing they say. It's when do we start?
They actually say, when do we start?
It's the number one thing we hear from them. And then what they love to hear is say, hey, look, we're done. You've been asleep for 3 hours or 5 hours or 1 hour, whatever it might be, but they have no recollection of it. And that is the beauty of IV sedation. Much, much better. Patients like that a lot better, because we have patients in our practice who have had IV sedation and oral conscious sedation.
That's the pill.
That's the pill, okay. Exactly, thank you. And the IV sedation, they would much prefer, because they don't remember anything. They're sleeping away. They're just dreaming away.
Well, that's good. Okay, we're going to take a quick break. We come back, we're going to go through these photos of people that there's no way they would have these type of smiles if it weren't for sedation.
That's correct.
You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
At Johnson Family Dental, whether you come in for a routine cleaning or a same-day emergency, we can handle all your needs with comfortable, pain-free procedures. With 90% less radiation, our digital x-rays and most emergency procedures can be completed in one day. Our interest-free payment plans make it easy to receive the care you need right now, and your first exam is free. Dental health is more than just a great smile. It's a priority.
Hi, I'm Dr. Steve Johnson. Come be part of our family.
I get a lot of compliments on my smile, and I'd like to keep getting compliments, and that's why I keep going to Johnson Family Dental.
Since I had my bridge installed, my new smile, I think, has made me less self-conscious in public, and I think it's improved my attitude a little bit.
Check out these dolphins. They've got 88 teeth. We only got 28. Take good care of your teeth. You'll have them for a lifetime.
Johnson Family Dental. A smile can change your life.
You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez, and today we're talking about don't let your fear of the dentist keep you from having the smile you've always wanted, or don't let the excuse that you're too busy keep you from having the smile you've always wanted. With us, we have Dr. Johnson, who one of the things that you offer is
IV sedation.
IV sedation,
Yeah,
oral
yeah.
sedation, nitrous.
Yeah,
And you say, just as a recap, I mean, they could do multiple procedures all in one day.
Absolutely, we could do everything in one day if we need to, or,
Okay.
or sometimes we'll do it in 2 days. You know, just depending on how big the case is and how complicated it is. But most of the time, we can do it in one.
Okay.
That's great.
So you brought some photos.
Yeah, we did. No, this is what case that we did actually in 2 days. Because when we do a smile makeover on a young girl or on a young man or whoever it might be, we have a specialized lab that does really high-end veneers for us. She just did not like her smile. She actually hated her smile. She'd walk around like this. She wouldn't smile. This is a beautiful girl. As you could see with her teeth right here, they're overlapped. You know,
Do they tell you that? They say, I hate my smile.
Yeah, it's exactly what she said. She goes, I do not like it. What can we do? So we gave her some options because I was kind of concerned. This tooth is almost 50% overlapped the other one. And so it's a pretty complicated case here. So we gave her some options. Said we can do some orthodontics. We can do what we call Invisalign and straighten your teeth out and then veneer them. Or we can go into what we call instant orthodontics, and we can do veneers, and we can really do a little bit more of an aggressive type of procedure on these two teeth here to make the veneers look more natural and seated so they're not too bulky or coming out too much. And so she's like, you know what? I just want my smile now. She just wanted to get it done. She didn't want to wait 18 months or 2 years to go through braces. And so we said, well, let's do it. These are your options. This is how we're going to go for it. But the other challenging thing with this is that she was very fearful. Fearful, not be, I mean, she can come in and have her teeth clean and this and that, but she was fearful more from the point, like, being in the chair for a long time, right? I mean, because this is a big procedure. This
Yeah,
will take a couple
gagging
hours.
and everything. I mean,
Absolutely.
it's a terrible thing
and
to
we
do,
said,
have to sit there.
And so we said, you know, we can do what we call an oral conscious sedation. You'll be totally relaxed here. We'll give you a little Valium. We didn't give her the blue pill. We'll just give you a little Valium along with nitrous oxide, and you'll just be relaxed. You can watch TV, look at the screen, and you can listen to any music you want, and we'll get it all taken care of for you. She loved it. She loved the outcome. And so she's very
Wow,
pleased.
look at that. Well, that's a big difference.
It is a huge difference.
What'd you do? So those are all veneers?
These are all veneers here. So we place veneers all the way across the top 8 teeth there. We gave her a whole new smile. You can see the difference. And she's just beaming, and she is so excited.
Even her lips look different. Like her upper lip looks different.
Yeah, you know what? It blends in. Because what happened here is if you have a smile that's straight across there or sometimes shorter, some patients, their teeth here, they look like they're a little older. They have what we call reverse smile. And so this patient who's maybe 25, sometimes they can look like they're 50 or 60 because their teeth are
Interesting.
worn down. So we gave her a little longer teeth. So now you can see that her new smile follows her lower lip line, and she loves that. And of
But
course,
your big thing is, you
they're
know,
not
people
overlapped.
wait and wait and wait. So she was probably miserable with her smile for a long time.
Well, her whole life because her
But
teeth
the
came in
fear
that
of the
way.
dentist, the fear.
Yeah.
Interesting.
Yeah, it's incredible. So we're happy that we were able to give her the smile that she wanted.
Okay, so that's an older woman.
Yeah, this is an older woman, a great lady, but she came in and she was just in tears. You know, her upper teeth up here, she had some crowns done recently, and she was so fearful to even come back to dentist because her 2 front teeth kept coming off, or the crowns kept coming off. And I said, you know what, we can make this work. We still have enough.
So why'd she go to you, by the way?
You know what,
she just recently had them done.
She was referred to us because I did some work on one of her friends, and she knows that we do sedation dentistry.
Okay.
Because
okay.
she is a little bit nervous. I mean, again, she wasn't like the fearful, like some patients that come in there are very fearful. Literally, they will be in tears.
Like a phobia.
Like
literally.
a complete phobia.
Interesting.
I mean, we actually have to let them stay outside our office for maybe 5, 10, 15 minutes, however long it
Wow.
takes to bring them in the door. And I've told my front staff, said, now if a patient calls in, and they want to know about sedation dentistry, be prepared to be on the phone for about 30 minutes with them, because they're going to have lots of questions. They're going to be very nervous, and you know what? And they are prepared to do that. But in her case, you know, she didn't have that type of fear. No, she wasn't a typical phobic patient that we see, but she was very fearful that maybe we were going to give her the smile that she wanted, because she just had
What didn't
this
she
gum.
like about this?
You know what?
Other than I mean, it doesn't
of
look
course,
so good.
the two front teeth keep coming off, but when they've been put back in, they're flaring way out. So if you look at her profile, they really are jetted out, and it's unfortunate. She can't bite into anything. She smiles, and it just looks awful.
Okay, so this after. So
So-
you do the sedation. What kind of sedation with her?
You know, again, in her case, she just wanted a real light sedation, take the edge off. She wanted to watch TV, so we gave her some
So you have
nitrous
TVs on the
oxide.
ceiling?
We have TVs on the ceiling. They can watch
Okay.
movies. They can listen to the radio. Whatever it is, we can put some masks, you know, over their eyes, and we just go to work. And so we asked her, like we asked our patient, what are your goals? How would you like your smile to look? We show some pictures of different smiles that we do, and they pick it out. This is what I want, and this is what we can deliver. And so she loves it. She is so happy.
Looks very nice.
Yeah, she's beaming now.
Very nice. Now, does she say obviously she should have done this a long time ago?
Oh,
or she should have gotten you first?
Yeah, that's probably what should have happened, or somebody who knew what they were doing. Because in this case, this person obviously needed some more training.
Okay, good. Okay, so what else? Let's kind of. And by the way, for the sake of time, we'll just go quickly through these photos if you don't mind.
No, that's
Okay.
perfect. Yeah. Now this is more of a severe case. So anybody out there who has kind of a weak stomach, you might not want to look at this picture
All
here,
right,
because
all right.
this is a patient who really has been struggling with drug addiction.
Let me take a look at
And
that.
you can take a look at that
my
there.
goodness.
And so this is somebody who's been on crystal meth, been on pot, and you could see that these teeth here are very black. Now they turn black because a lot of the enamel was eaten away by the drugs that he was doing. And when the enamel is eaten away, then that second layer.
And you could fix that?
You could fix it, absolutely. And so-
Without just pulling them out?
you know what? In this case, we had enough tooth structure to work with, believe it or not, without
Interesting.
pulling them out. So we removed all the black stuff in there, the bacteria, and we were able to do some root canals on him, friendly root canals. Okay, you know, he had no idea because he was in a total dream state. He was dreaming away, and so, but if he knew about the root canals, I mean, he knew, of course, what he had to do before we
So
started.
pain is another thing he didn't complain about after the procedure.
Zero pain. In fact, he's
Very nice.
smiling, he's beaming, he loves it.
So this is the after. It looks very nice.
Yes, yes.
That's obviously a pulled back view.
That's a pulled back view, and again, I would love to give a facial shot because just has a smile from ear to ear now.
So no matter how far gone they are, like this, for example.
Yeah.
You're never too far gone.
Never too far gone. In fact, let's say in this case here that we couldn't save the teeth. It's beautiful now with implants, right? We can place implants in there, and we can give them a nice bridge. We can give them a nice denture that's fixed to the implants. And so that's another thing. It doesn't matter if the tooth has to leave.
Time for just
Yeah, you know,
couple
like
more.
I talked about, now this is someone who's just close to 80 years of age who waited his whole life.
Wow.
And it's because of the fear of us doing this type of work on his teeth. He was wondering, well, how would it look? He's gone through implants. He's gone through so many different fillings, but look at how crowded his teeth are. That is a virtually nightmare.
So 80 years
to clean.
old.
80 years old. You know, check all this crowded out you can see right here. I mean, this guy is really self-conscious of his smile. And the unfortunate thing is, this guy has money. He is extremely successful. He's a well-known artist. And he just said, you know what, Steve, I know I'm clady. Is it silly for me to do this or not? My teeth feel like they're even getting more crowded. I just am really self-conscious about it. I said, you know what, there's no problem. We can fix that for you. And we were able to go ahead and put crowns on all these teeth. Now, we had to do crowns on each one of those teeth because he was so crowded. We had to make enough
Looks very
room.
nice.
But he is just ecstatic about it and loves his new smile. In
And
fact,
what kind of sedation for him?
we did some light conscious sedation for him, and he was very thrilled. You know, this is what I love about the 70, 80-year-olds. Most of them, 90% of them, they're a tough group. All right, I mean, most of them could just go in and not have any anesthesia done. And he is just an amazing, amazing individual. And when we put this in, his wife was with us right before we cemented him. I said, what do you think? Because you're going to have the final say. You're going to be looking at him all the time. And she just started crying. She thought it was amazing.
Wow. Wow. So what was he not smiling?
He was
prior
not
to this
smiling, no.
because he didn't like his teeth?
And the whole thing, what I wanted to tell him was like, gosh, too bad you didn't do this 40 years ago. My father could have done it, you know, or something, you know, but
Okay.
but he's thrilled. You know, he's just glad he's finally got it done, and his kids like it, his grandkids love it, and so he's extremely happy.
Okay. Now, again, if you're just tuning in, we're talking about IV sedation, conscious sedation, nitrous,
Yeah.
that in your office, you suggest people do it.
Oh, absolutely. The nitrous, absolutely. In fact,
I mean, you suggest they get something to relax them.
without question, we love to have some type of sedation in there because it's more relaxing. It's more relaxing to them, and it's more relaxing to us. You know, so when you have a relaxed dentist working on you, you're going to have a great outcome.
You're also involved, I guess, with the Juvenile Diabetes Association. You have a Santa Barbara walk.
We do. Each year we do have a Santa Barbara walk that we are heavily involved with. We're actually the corporate chair for JDRF, the walk, and this will be our 3rd year doing it. And I'm also very heavily involved on the board of JDRF in Los Angeles.
And that's the Diabetes Association.
And that's the Diabetes Association, exactly. Well, it's the Juvenile Diabetes Research Foundation. And so the reason I'm so involved with this is because my son Braxton was diagnosed with type 1 diabetes 3 years ago. He's 13 now, but let me tell you, it changed our life. It changed his life. It was very devastating because we didn't really know what it was. In fact, when he first got diabetes, he thought, am I going to die? Because the term diabetes says die. And we said, no, we just need to be educated in this.
So type 1, what's the biggest misconception about type 1 in adolescence?
It's a great question. And what we really want the teachers and the public and everyone to know out there is a big difference between type 1 and type 2. Type 2, you can actually start to exercise and change your diet and you can become better. Type 1 is an autoimmune disease. It's a virus that attacks the pancreas and it does not allow the insulin to produce. You cannot get that back.
Okay.
And so you are insulin dependent for the rest of their life. So these kids or adults who have type 1, they are becoming very educated with their own bodies. I mean, they have to know exactly how many carbohydrates they're going to eat, and they need to know what they got to take in their system.
They have to be careful what they eat and what they do?
They do have to be somewhat careful, but what I want people to know is they can eat and do whatever anyone else can do. So for instance, you know what, if they want to have a bowl of spaghetti, which has a lot of carbs, they can do it. They just know how many carbs it is and put the insulin in.
What about cake?
Absolutely. If they want to have cake, you know, my son went to a birthday party and everybody got a piece of cake, and the mom, she was trying to be great, she gave him some chewing gum. Another party, they gave him a bowl of fruit. It's like, no, they don't want this. They want to feel totally normal. They can have cake, they can eat whatever they want. So, yeah, it is.
So you're involved in educating people about that.
We are involved about educating because we want people to know that there is a difference. They can lead a healthy, normal life. Most of these kids are athletes. There's a lot of professional athletes with type 1 diabetes. You know, they can live a healthy, normal life.
All right, great. Well, I want to thank you so much. You also have information about that on the website.
Thank you. No, we
if
do.
They want to be involved in the walk.
Yeah, just go to our
whatever.
website and just click on JDRF and you know right when the walk is.
And if you're watching this, and by the way, we're talking about fear of dentistry. So last message to these people that are still watching this, but they're just afraid of going to the dentist.
You know, my last message would be, if you're afraid to go to the dentist, just come on in and give us a try. We will take good care of you. We are specialists in this area, and we will make sure you have an amazing experience. And if you're someone who isn't afraid, but you know somebody who is, you know, have them give us a call.
Tell them about you.
You know, absolutely, we can fix them up.
Go see Dr. Johnson.
We'd love to.
Well, thank you so much for coming to the show. Always a pleasure.
Yeah.
Thanks again for coming down.
Thank you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com and just put in Santa Barbara Dentist and you'll find them there, or of course Dr. Johnson. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
Hi, I'm Randy Alvarez, host of The Wellness Hour. We are currently looking for licensed health practitioners to be on the show. So if you have something to say, a great message, a new breakthrough, you have to let us know about it. Visit wellnesshour.com, click on how to become a guest, or just email me directly at randy@wellnesshour.com. If you know a doctor that you think would be great on the program, send them my way. We'll see you here.